So the BSW Academy is a real opportunity for us all across the ICS to invest in and unleash the potential of the huge talent that we've got working across the whole partnership. So health, social care and the third sector. It's an opportunity for us to make BSW greater than the sum of its parts, knowing that we're all doing very good things individually, but how can we build that up and bring the best of what we do together for the benefit of everybody. What we know is we've got some organisations that are too small to be able to drive forward the sorts of improvements that are needed because they don't have the capacity in there. We know that we don't have capability in all areas of the system. And so what we want to do is make sure that we're all playing our part and bringing that together in the Academy to be able to drive forward improvements. I think one of the big things coming out of the pandemic is how much we've learned about the improvements and the speed at which we can work if we work together as a virtual team. So we've seen that during the pandemic and most recently in the amazing work that teams have been doing to roll out the vaccine programme. And I think that's a sign of the level of energy and ambition that exists within BSW. And so the Academy is about realising that potential and taking what we know from COVID and how we can work together as virtual teams, bringing that together and thinking about how we can work together in a different way so that we can sustain that level of ambition, that level of energy for our patients, for our staff and for the communities that we all serve. There are lots of benefits we think we'll be able to deliver through the Academy, and I'll pick a few live examples. The whole conversation that's happening within organisations, within communities around at the moment, particularly on health inequalities and inclusion, that's something that we're all grappling with. How do we make our workplaces as inclusive as we possibly can, and how do we make the services that we provide more inclusive and target those members of our communities that might be disadvantaged? Now, why are we doing that all, 10 different times in all of our different organisations? Why can't we bring together that learning in a central place, in a central resource where we learn from the best and learn about what is working? We've got a great track record in BSW already. The work on the vaccination programme, the work to support the boating community is an example. And we think we want to be able to lift that up to a bigger level and make sure there's easy access to resources, talent and skills that can help other organisations that might be grappling with the same thing that somebody else has already considered and already answered. The other area as well is about our leadership development and talent management. So how do we make sure that those people at any level of our organisations are supported to be the best leaders that they can? So whether that's leading a service or whether that's leading an organisation or whether that's leading just indeed a sort of small team, we want to make sure there's resources to build that capability at every level so that people can really help shape and make changes to their services for the benefit of their patients and their team members.